In June of 2020, Denver launched the Support Team Assisted Response Program. The STAR program represents a more empathetic approach to policing by having a mental health clinician and paramedic help troubled, nonviolent people in distress get the services they need.
We recognize that people call 911 for a variety of reasons, some which require an emergency response and some that don't. So if you need transport to a shelter, or you need community resources, or are dealing with a low-level crisis, STAR is really the best option for that.
We respond to low-level 911 and non-emergent police calls for a variety of different things, including mental health emergencies, people experiencing homelessness who need connection to resources, and then just checking on people who other people in the community might have called about.
The police have been very supportive, and actually about 30% of our calls are initiated by DPD officers that show up on scene first and recognize that they're not the appropriate response for that situation and radio to have STAR come take over the call.
It's a social worker and a paramedic, so you don't have two people in police uniforms carrying guns responding to people who may have had unfavorable interactions with the police in the past, or might have a criminal record that they're concerned about, or might be experiencing substance use issues and be a little bit more fearful of the police department. When we respond, they know that they can trust us and that we can work with them to kind of get them resources they need.
A lot of the calls that we're responding to have a mental health nexus. We've seen a lot of kind of low-level depression and anxiety calls, all the way up to people who are dealing with severe and persistent mental illness, such as psychosis.
Unlike being on the ambulance where we have a bunch of medications and medical interventions we can do, I think our toolbox is really our social workers and their knowledge of the system, all the available resources, how to connect people with the care that they need. It's been a great learning experience for me to know that there's other ways that we can help people outside of just taking them to the hospital.
As a social worker, I have a long history in community mental health here in Denver, so being able to be out there and meet the needs of our community on STAR is really my passion and has really been very fulfilling.
About 35% of calls to STAR personnel come from police officers. The approach highlights how this alternative to policing provides the focused care needed for distressed individuals in our community.
Early on in the pilot program, we had a situation where someone had called 911 because a gentleman was down on our 16th Street Mall area in a broken wheelchair and appeared that he needed some help. And through talking to him a little bit, he said that he was a veteran and that he really just needed to be reconnected with the VA. And because was a case manager in Denver early on in my career, I have a really good contact at the VA who I can call, who always helps me out, provides me with really good information. And he actually knew who this gentleman was and said that he had been looking for him for the past 3 months and didn't know where he was. And really just asked us to transport him up to the VA hospital so he could be medically cleared and have his physical health needs addressed, and that he'd be reconnected with his treatment team. So we drove him up there and were able to make that happen really easily, and I think solved a few problems for this guy that day, and he was very happy.
We responded to a party who has multiple disabilities and was staying at one of the local shelters. And he was telling us that he has been having some issues with some people there and he wasn't very comfortable going back. I continued to talk to him and try to get some more information about what was going on and why he didn't want to go back. And it turned out he had been being assaulted there, which is very unfortunate, and that because of that he's been feeling just kind of low-level suicidal ideation, that he needed some support, needed some housing resources, needed connection with case management. And so we were able to get him over to the walk-in crisis center, and they were so great and able to help him in a meaningful way. And that it felt really good to kind of get to that point and been able to help him appropriately.
I think that when you're able to go out and listen to people and, solve problems and meet people's needs, that's really what keeps you going. I think it's probably the same for the medics as well. You're able to help and help people on what might be one of the worst days of their life. And I think being able to provide that support and have that opportunity through STAR has just been really incredible.
Don't miss the next full episode of Your City Now.